I'm Chloe, I'm a trainee advanced practitioner. I work for GTD Healthcare and I specialise in sexual health and contraception. For this video I'm going to discuss the insertion of the contraceptive coil. So there's different types of coils. So there's the IUS, which is hormonal. So there's the Mirena and the Coil, which are in for 5 years. And then there's the IUD, which is non-hormonal. So there's a 10-yearly IUD and a 5-yearly IUD. So what are the differences between the types of coils? With the IUS, the hormonal coil, there's the Mirena and the Coil. So bleeding wise can vary. So bleeding can either stop completely or it can make it regular and light. In terms of the Mirena coil, it's also licensed for women for menopausal symptoms for HRT. It's also licensed for women with heavy painful periods as well. So with the Coil, it's slightly smaller than the Mirena, so it can make it more favourable for women that have not had children. With the Mirena coil, it's got slightly more hormones than the Coil, so it's more likely to stop periods completely. Here's the side effects with the coils. So despite having hormones in the IUS, the side effects compared to the contraceptive pill, for example, or other hormonal methods is much lower. The reason for this is because the coil usually targets the uterus rather than the body, so it is rare to experience the hormonal side effects with them. With either of the coils, it's quite normal to get regular spotting initially after the procedure, so this could take even up to 6 months to settle. If this becomes problematic, contact your GP who may be able to prescribe you the pill until the bleeding settles itself. So with the IUD, the non-hormonal coil, the bleeding pattern can make periods more heavy and more painful. So if you experience heavy and painful periods already, I would advise against this coil because it could make it worse. For a coil fit, first of all I examine you, so I feel inside the vagina and feel the abdomen as well, and this is just to assess for any pain or any abnormalities. So once I've examined you, I need to insert a speculum inside so I can visualise the cervix. So the cervix is then sprayed with a local anaesthetic spray. I then insert a clip onto the cervix to stabilise it while I pass the coil through. So I then need to measure the depth of your uterus, and this is so the coil's fitted in the right position. So I do this with this device. I insert it through the cervix and out. So it's very quick. And then I insert the coil with this inserter. So it's aligned to how deep we know your uterus is from measuring it. And then we insert the coil, the arms spring back, and it just sits in place like this. And these threads here are cut to approximately 2 centimetres from the cervix, so they won't interfere with sex. So the purpose of the coil threads are useful for 2 things. So first of all, so that we can remove the coil easily, and to be able to do this, we insert the speculum, grasp the threads with some forceps and just remove the coil. Okay, so it's usually painless and straightforward. The other reason for the threads is so that you can feel them yourself. So it's useful to do this 2 weeks after the procedure and then monthly thereafter. And this is just so that you know that the coil's in the right position. Risks with a coil. So there's 1 in 20 risk of expulsion. So expulsion basically means the coil could push itself out. So it is recommended for you to check the threads for this reason, so you can ensure that the threads are in the right position. There's also a risk of perforation, which means that the coil could perforate the uterus. Now a perforation generally heal on their own, but with a coil in place, this could then make the coil more difficult to remove as it could travel upwards. The risks for the perforation is 1 in 500, so the risks are rare. Okay, infection risk after a coil is usually more common within the first 3 weeks after a coil fit. So it's advisable just to avoid sex, swimming and tampons for at least 7 days after a coil fit. This is just to minimise the risk of infection. If you notice any offensive discharge, if you feel feverish or unwell, contact your GP who can assess you.